Hello, good morning, good afternoon, good evening, wherever you are watching me from. You are welcome to today's program, Living and Managing Diabetes. How are you guys today? I hope all of you guys are doing fine. Okay, well, today I'm going to be discussing about easy ways to lower your blood sugar naturally. We're going to be discussing how do you lower your blood sugar naturally. Okay, so I'm going to be giving you guys some tips on how to manage your blood sugar naturally. Okay, so while I'm waiting for everybody to come online, if you guys have any question, feel free to ask me any question, send in your questions, your comments, and do not forget to subscribe to my page if this is your first time. If you are not yet subscribed to my page, kindly do so. Give me a thumbs up if you like what I'm doing. Give me a thumbs up and then subscribe to my page. Also share. Invite your friends to join the community. On this page, we discuss about diabetics, related issue about diabetics, cholesterol issues, high blood pressure. These are all related issue with diabetics. Okay, so we'll try to give guidance and tips how to live and manage your diabetics. So today I'm going to be discussing easy ways to lower your blood sugar naturally. Okay, easy ways to lower your blood sugar naturally. So while I'm waiting for uh, audience to join this program, I will be free to entertain any questions. I'll be free to entertain any questions. Okay, I'll be free to entertain any question. All right. Easy ways to lower your blood sugar naturally will be today's topic. For those that are watching me from Africa, Asia, Europe, you are welcome to today's program. Right? You guys are welcome to today's program. Mhm. Do not forget to subscribe to my page if this is your first time coming into my page. Do not forget to subscribe to my page. Okay. How are you guys doing? How are you guys doing? How are you guys doing? Happy weekend, happy Saturday. Okay. I'm waiting for my audience to join and then we could start the program fully. All right. I'm going to be discussing easy ways, easy ways to manage your blood sugar naturally. Okay. That is what I'm going to be discussing today. Sorry that I came in late. All right. Knowing how to reduce your blood sugar levels naturally is key to managing your diabetics or pre-diabetics. Okay. We have pre-diabetics and we have diabetics. So knowing how to reduce your blood sugar levels naturally is key to managing and living with your diabetics or pre-diabetics. Diabetics or pre-diabetics is all about managing your blood sugar levels. Once you're diabetics, now you are having issue about the level of blood sugar levels, sugar level in your bloodstream. So, in a nutshell, in a simple sentence, it's all about managing your blood sugar levels. But in managing your blood sugar levels, there are other things, there are other components that you also have to understand. That is why it is very, very difficult if you're a diabetic. There's a lot of confusion in the beginning. Once you are newly diagnosed as a diabetic, you're going to be in a state of confusion because you don't know where to start and where to end. But with time, you're going to get used to it on how to manage your blood sugar levels, starting from your medications, how you can live and manage it, and then to your diet. So everything have to work hand in hand in order to attain to those goals in reducing your blood sugar level to a normal level. So it's all about managing your blood sugar level. So knowing how to reduce your blood sugar levels naturally is key to managing your diabetics or pre-diabetics. As I said in my several videos, it is not mandatory, it is not necessary that you must be on medication to control your blood sugar levels. There are patients, there are people that are not on medication and they are able to manage their blood sugar level naturally. So everything depends on the discipline, how disciplined you are to take your diabetic situation very serious. Because if you don't take diabetic situation very serious, that can cost you your life or your limbs or your leg. So it is not everybody that is diabetic that is on medication. There are a lot of thousands of people that are diabetics, but they're not on medication, but they were able to control their blood sugar naturally and they're living a normal life perfectly. It's all about discipline and then listening to your family doctor. Okay. And if you know that you cannot control your blood sugar naturally, then you have to be on medication. Alternatively, you could be on medication at the same time on exercising and then managing your diet. So every individual differs on how they manage their blood sugar levels. So you have to choose which way is better for you on how to manage your blood sugar levels. Do you want to manage your blood sugar levels naturally, or you want to be on a medication, or you have to go on dieting or exercising and reducing your weight? So these are some of the ways, some of the plan you and your family doctor have to sit down and analyze which is the best way to treat your diabetes issue. But you as a patient have the burden to convince your doctor, you know what, I don't want to be on medication, but I can manage my diabetes without be on medication and control it naturally. So everything have to go hand in hand. The discussion have to be between you and your family doctor on ways to manage your blood sugar level naturally, either you're pre-diabetics or you're diabetics. Remember, there are other complications that comes with diabetes if it is not treated or if it is not taken seriously. So you also have to guard against all those situations. Okay. So that is what we're going to be discussing today: ways to manage or to lower your blood sugar naturally. Okay. So as I said, knowing how to reduce your blood sugar levels naturally is key to managing your pre-diabetes or diabetes. Consider actions. There are some actions that you have to consider, such as exercising regularly, eating more fiber, incorporating more snacks, and increasing your probiotic intake, and then reducing your carb intake. So these are some of the actions that you have to take into consideration while managing your blood sugar level naturally. As we go along, I'm going to give you guys ways how we can manage our blood sugar level naturally. Okay. If anybody has any question, feel free. If you guys have any question, feel free to ask me while I'm on the program. So if anybody have any question, do not forget to ask me any question. All right, I'll be open to answering your questions. I'll be open to answering your questions. All right. So that is the heading for today's topic. So I'm just delaying a little bit so that people can come online before I go into it, because once I I continue now. Once they come online, they want me to go back all over again and then start all over. So uh, let's. I'm just waiting for um, you to come online. Do not forget to subscribe to my page. If this is your first time, do not forget to subscribe to my page and give me a thumbs up if you like what I'm doing. All right. So now, high blood sugar, also known, okay, high blood sugar, also known as hypoglycemia, is associated with diabetics and pre-diabetics. Pre-diabetes is when your blood sugar is high, but not enough to be classified as diabetics. That is borderline. Okay. So that is borderline. So high blood sugar, also known as hypoglycemia. Hyperglycemia is associated with diabetics and pre-diabetics. Pre-diabetics, it is when your blood sugar is high, but not high enough to be classified as diabetics. And that is why they call it pre-diabetics, or in other words, call it borderline diabetics. Okay. Now, your body usually manages your blood sugar levels by producing your body usually manages your blood sugar level by producing insulin, okay, a hormone that allows your cells to use circulating sugar in your blood. Insulin is the most important regulator of blood sugar. Okay, so I've told you guys um, why you are diabetics. There are two situations why you are diabetics. It is when your pancreas is not producing enough insulin to regulate or to control the sugar level in your bloodstream, or in another circumstances, your pancreas is producing more than enough insulin that your body needs, but it doesn't know how to use it effectively to control the sugar level in your bloodstream. Okay, so you're in a state of quagmire. Now, remember in that pancreas, there's something we call meta cells. And when those meta cells are destroyed or damaged, ineffectively, your pancreas is not producing enough insulin that your body needs to regulate the sugar level in your bloodstream. Or in other words, your body, I mean, your pancreas is producing enough, more than enough insulin, but it doesn't know how to use it effectively to control the blood sugar levels. So when your body usually, so our body usually manages our blood sugar levels by producing that insulin. Insulin is the key. Okay, it's a hormone that allows your cells to use the circulating sugar in your blood. All right, insulin is the most important regulator of blood sugar levels. So if your pancreas is producing more than enough that the body requires to regulate the blood sugar, I mean the sugar in your bloodstream, it's a problem. Now, if it is producing more than enough that your body needs, and then but your system doesn't know how to use it effectively to control the blood sugar level, it becomes a problem. Or it is producing less than enough that your body needs. That is, it's producing insulin, but it's not enough so that your body can use it to regulate the sugar level in your bloodstream. All surrounds the destruction of your pancreas. So once those meta cells are destroyed, now you're going to have an issue of insulin problem. And once your pancreas is not producing those insulin that your body needs, then you become diabetics. Because now you are having too much elevation of blood sugar. You have a lot of sugar levels in your bloodstream. And when there is too much sugar level in your bloodstream, it becomes a problem health-wise. It attacks and destroys other cells and organs of your body. Okay, so that is why you have to understand the role that insulin plays in our body. It is very important to understand the importance of insulin and the role they play in regulating the sugar content in your bloodstreams. And once those meta cells are destroyed, you have a problem because there are going to be too much elevation of blood sugar in your elevation, too much of a high, concentration of sugar levels in your bloodstreams. Okay, so once you understand the roles that insulin plays in your system, they should be able to understand why you become diabetics. Once those beta cells are destroyed, it's not something that can be recovered. You can only reverse diabetes when it's in the you can only reverse diabetics when it's on the borderline pre-diabetes. You can reverse it back because you caught it in time, so you can reverse it by changing your diet and your lifestyles. But once it crosses that threshold of borderline and becomes full diabetes, you can never reverse it back because the meta cells have been destroyed. All you have to do now is to live with diabetes and manage it properly. And how do you manage it properly is to make sure at all times you control your sugar levels, and then you also have to consider your dieting, and then inculcating exercise, and then reducing your weight if you're obese. So these are certain things you have to understand about diabetics. Okay, so that is it. And I said high blood sugar, also known as hyperglycemia. Remember, I'm saying hyper, not hypo. Hypo is low, hyper is high. Is associated with diabetics and prediabetes. And the prediabetes is when your blood sugar is high, but not high enough to be classified as diabetes. That means you are not yet diabetes. So once you're on prediabetes or borderline diabetes, you stand a chance to reverse it back because it has not crossed that threshold. Okay. So now let's discuss how there are multiple factors. Okay. There are multiple factors that can impair blood sugar management and lead to hyperglycemia. Okay. We have the internal factors and we have the external factors. So we have two factors that can impair blood sugar management and lead to hyperglycemia. And as I said, we have the internal factors and we have the external factors. And what are those the internal factors? Okay. What are those internal factors? Right. Internal factors causes for high blood sugar include when your liver produces too much glucose, your body makes too little insulin, or your body can't effectively use insulin. The latter is known as insulin resistance. That was what I was trying to explain just a while ago while we were diabetics. The production of insulin. Okay, your liver is producing too much glucose, that is too much sugar, but your body is producing less insulin to counter those sugar that your liver is producing. Now, the whole sugar is now being dumped into your bloodstream, and there's an elevation. Or your body is producing too much insulin that your body needs, but it doesn't know how to use it effectively to control those glucose that your liver is producing. So that means your system is not working effectively. There is a problem with your beta cells, your pancreas. And when there's a too much concentration of sugar level in your bloodstream, that leads you to become diabetes and becomes insulin resistance. You see, because those are the internal factors. Because now your liver, okay, it produces too much glucose, which is sugar, and then dump them into your bloodstream. Now your body, your pancreas is now producing little insulin to counter those glucose that your body is producing, and your body can't effectively use those insulin because it is producing less insulin. It is not enough to regulate the glucose that your liver is producing. And that is what is called insulin resistance, and then you become diabetic. All right. So I'm trying to break down what causes diabetes, why you're a diabetic, so you know why all of a sudden from a childhood you are not diabetics, in your adult stage you become diabetics. It's a progression of one thing that leads to another. And what are those things that lead to another is when you are taking all, consuming too sugar items. Your lifestyle is not well balanced. Okay, you're eating too much of carbs instead of fiber. So there is a progression from one stage to another, from one stage to an extent that your pancreas cannot take it anymore, and then the metal cells are destroyed. Now, your body cannot produce in the insulin enough that your body needs to control or to counter the glucose that your liver is producing. Then that becomes a problem. Okay. So, as I said, there are two factors that can make you have diabetic hypoglycemia. We have the internal factors and we have the external factors. I'm discussing about the internal factors. The internal factors that causes high blood sugar include when your liver produces too much glucose. All right. And then your body makes too little insulin to counter the glucose that your liver is producing. Your body can't effectively use those insulin. The latter is called insulin resistance. Now, your liver is producing too much glucose and then releasing it into your bloodstream. Now, at the same time, your pancreas is not producing enough insulin to use to regulate those glucose that your liver is producing. Either it's producing less insulin or more than enough insulin, but your body doesn't know how to use it. Then that's when you develop insulin resistance and become diabetics. Okay? So those are the internal factors. Now let's go to the external factors. Okay? Now, the external factors include dietary choices. Okay? When you are consuming too much of sugary items, a lot of puffs, a lot of candies, a lot of chocolate, that is, in a day, you consume most of your food contains a lot of sugary items. You drink about 20 bottles of Coke or Fanta or whatever, 7 Up. Okay, you eat a lot of carbs. You are not balancing your diet. A lot of carbs. Remember those carbs you are eating also, once it gets into your system, it converts them into glucose. So you are not eating less carb, more fiber, but most of your food, your diet is always carb, carbs, carbs, and a lot of sugary items. Okay, so those are the external factors that can lead you to high blood sugar level, because at a point your pancreas cannot take it anymore. So those are the external factors that can cause you to have high blood sugar level. Include your dietary choices, certain medications, a sedentary lifestyles, and stress. Stress can also make you to have high blood sugar levels, because that is why you have to reduce your stress level. Stress can make you have uh, high blood sugar level, so you have to reduce your stress level. Alex, you are welcome. You're welcome, long time, Alex. You're welcome back. So, stress is one thing that can cause you to have develop high blood sugar level, because those are the external factors. Okay, those are the external factors. We have the internal factors and we have the external factors. So the external factors is your dietary choices, consuming most of your in a day. You take too much of sugary items. Okay, a lot of carbs. Certain medication can also raise your high sugar levels. Uh, Sedentary lifestyles. That is, your lifestyle is not balanced. Too much of carbs, and then stress level. Once your stress level is too high, it can help make you develop high blood sugar level. That is why, as a diabetes, you must make sure that your stress level is always low. Okay. Now we are going to go into. I'm going to discuss about. Let me. Let me make it. Let me make it. I'm trying to. Uh, trying to. Where is it? So I'm going to discuss about the I'll be trying to limit it to six, but if I have more time, I can go beyond six. Okay, if I have more time, I can go beyond six. Okay, so we're going to discuss. I'm going to discuss about six uh, uh, easy ways to naturally lower your blood sugar levels. Okay, I'm going to see if I can get up to six if time permit. Okay, um, number one is exercise. Remember, I'm discussing about six easy ways to naturally lower your blood sugar levels. So number one is exercise. You know, exercise is one of the easy ways to reduce your blood sugar levels. Okay, when you exercise regularly, regular exercise can help you reach and maintain a moderate weight and increase insulin sensitivity. As a diabetic, okay, about a while ago, I say insulin resistance. Okay, when your liver is producing too much glucose and your body is making less insulin to counter the glucose that your liver is producing, it becomes insulin resistant that leads you to become diabetic. Now, To counter that insulin resistance is insulin sensitivity. We have insulin resistance that leads you to uh, diabetes because your body is not producing enough insulin to regulate the sugar level in your bloodstream, or your body is producing too much insulin, but your system doesn't know how to use it effectively to control the sugar level in your bloodstream. Now, the opposite of insulin resistance is insulin sensitivity. It's like you waking up a sleeping dog. So when your pancreas is lying dormant, dead, okay? Remember, when your beta cells are damaged, it's not like they are completely damaged or dead 100%. They are damaged, they are dead, but there are still some lives in them. They are producing insulin, but the insulin they are producing is not enough to regulate your sugar level in your bloodstream. Or it is producing more than enough insulin that your body needs, but your system doesn't know how to use those insulin to regulate the sugar level in your bloodstream. And remember, too much of insulin in your body is also very bad. It can cause you health issues. So when they say beta cells are damaged or your pancreas is dead, it is not like it is 100% dead. There's no life in it. There is life in it. But the question is that it is not producing enough insulin that your body needs to regulate the sugar level in your bloodstream, or it is producing more than enough. But one thing, your system doesn't know how to use it to regulate those sugar level in your bloodstream. So how do you waking up those beta cells, those pancreas, is to increase the insulin sensitivity. And how do you increase the sensitivity to insulin is by frequent exercise. When you are exercising regularly, you are putting life back into that beta cells that are damaged, into that pancreas. That is what is called insulin sensitivity. Instead of insulin resistance, now it becomes insulin sensitivity because now you are exercising regularly. When you're exercising regularly, you are putting back life to that beta cells to produce more insulin that your body needs to regulate your sugar level in your bloodstream. And that is why you see people that exercise regularly, consistently, and well disciplined don't depend on medication to control their sugar level, because that exercise alone is more than enough to increase the insulin sensitivity, to regulate the sugar level, to produce the insulin that your body needs to regulate the sugar level in their bloodstream, coupled with balanced diet. So you see it, if you are exercising regularly, you are putting life back into the beta cells that are dead. You are waking them up to produce more insulin effectively so that your body can use those insulin to regulate the sugar level in your bloodstream, thereby reducing your dependence on medication, because now you are exercising regularly. Okay? So that is why I say regular exercise can help you reach and maintain a moderate weight and increase insulin sensitivity. That's one way to lower your blood sugar naturally without depending on medication. Okay? Another important factor about exercise is that exercise also helps your muscles use blood sugar for energy and muscle contraction. Remember what I was talking to you guys, when you exercise, once your body goes into physical activities, your system, your heart rate, your everything, your body is going to change. That okay, now it's into exercising. When you're sitting down, your body will know that you are sitting down and then adjust your blood pressure, your heartbeat according to your position. When you start jogging or doing some intense exercise, your body can recognize that now you are doing physical exercise and adjust your blood pressure, your heartbeat according to that situation you are in that moment. And what happens once you're exercising? Once you're exercising, your system, your body goes into and mop up all the excess sugar that is in your bloodstream and then store it into your muscle and your liver. That's the importance of more exercising. It goes into your bloodstream and mop up all those excess sugar that in your bloodstream and then store it. Remember, when you're exercising, you are burning energy. So it's mopping up those excess sugar in your body, and then you are burning them out through sweating. That's why as soon as you finish exercising, if you check your blood sugar level, see your blood sugar level will have come down to normal. So exercise also helps your muscles use blood sugar for energy because it's mopping them up to be used as, because when you are doing intense exercise, you are burning energy, you need more energy. And muscle contraction. Okay. So when exercise helps your muscle to use blood sugar energy, and muscle contraction increases insulin sensitivity, means your cells can more effectively use available sugar in your bloodstream, because those sugar in our bloodstream is our energy. Once your blood sugar is depleted, you become weak, loss of concentration, because your sugar level have dropped below the normal level, so you need to pump it up. So this is the second important aspect of exercise. Exercise also helps your muscle to use blood sugar for energy and muscle contractions. And when there's a muscle contraction, it increases your insulin sensitivity, which means your cells can more effectively use those available sugar in your bloodstream. All right. So let's continue going forward. Okay. If you have problem with blood sugar management, consider routinely checking your levels before and after exercising. This will help you learn how to respond to different activities. Before you start exercise, take your sugar levels reading to know. And once you finish exercising, take your sugar level to know the reading. Because there's a reason why you have to check your blood sugar during, before, and after. Before the exercise, your blood sugar might be slightly higher or normal. And after the exercising, there's a tendency that your blood sugar level might have dropped below the normal level because you've expelled too much energy. You've used a lot of energy. The sugar in your body is converted to energy. Because once you're in physical activities, you are burning energy. So you are mopping up the extra energy that you have in your system in order to continue your physical activities. So there's a tendency after you exercising that your blood sugar might be lower or normal. So that is why it's advisable, once you finish exercise, take a sugar reading to know the state of your sugar reading at that time. That will help you to manage your sugar level and respond to different activities. Okay, so it's very important. If you have a problem with blood sugar management, consider routinely checking your blood sugar level before and after exercising. Okay, it is very important you check it before and after exercising. I'm still on number one. Ways to lower your blood sugar level naturally is number one is exercising. I'm still discussing about exercising, the importance of exercising, why you should use exercise to control your sugar level. It is very important. Okay. Now let's go to plus. Know that if you have trouble dedicating longer period to exercise throughout the week, you can still gain many benefits by doing shorter sessions. For example, okay, if you know you cannot go to gym or go to involve in physical activity every day, you can do shorter sessions. For example, okay, by aiming for 10-minute exercise sessions 3 times a day for 5 days with a goal of 150 minutes per week. Okay, with a goal of 150 minutes per week. Okay, so I'm trying to let me go back again. Plus, know that if you have trouble dedicating longer period to exercise throughout the week, you can still gain many benefits by doing shorter sections. For example, aiming for 10-minute exercise session 3 times a day, 5 days with the goal of 450 minutes per week. Okay, so that's for exercising. Now, what is my final thought about exercising? Huh? What is my final thought? Exercise increases insulin sensitivity and help your muscle use blood sugar for movement. This can lead to reduced blood sugar level. That's my final thought on exercising. Okay. So number two, ways you can lower your blood sugar naturally. Let's go to number two. Number two is manage your carb intake. Manage your carb intake. Okay. Your carb intake strongly reduces your blood sugar levels. Your carb intake strongly influences your blood sugar level. Okay, I want you guys to make a note of this. Manage your carb intake, and your carb intake strongly influences your blood sugar level. The amount of carb you consume per meal per day influences your blood sugar level. Remember about carbs. Carbohydrate is also sugar. Once it goes into your system, it converts it to sugar. That is what is, once you become diabetic, you'll be hearing less carb, more fiber, because those carbs you are taking is going to influence the level of your blood sugar levels. The more carbs you consume per meal, per day, is going to influence the level of your blood sugar level, because those carbs, when they go into your system, they convert it back into sugar levels and they dump into your bloodstream. Okay, and we have different type of carbs. Okay, so but that's another topic for another day. So uh, your carb intake strongly influences your blood sugar level. Okay, A, your body breaks carbs down into sugar, mainly glucose. Then insulin helps your body use and store it for energy. Okay, so that's what your body does. It breaks down those carbs down into sugar. So once you consume food that are carbs like yam, corn meals, semolina, cassava meals, those are carbs. So what does it do? Your body breaks down those carbs into sugar. That is glucose. Then the insulin helps your body to use and store it for energy. Because what the insulin is going to do is to regulate the amount of sugar in the bloodstream. And then the remaining ones is store them as energy to be used for later time. But what happens if your body is not producing enough insulin to regulate those carbs? That is when you develop high blood sugar levels, hyperglycemia, diabetes. Because now you're having insulin resistance because your body is not producing enough insulin that your body needs to regulate those sugar levels. Or it's producing more than enough, but the system doesn't know how to use it effectively. So that is why the amount of carb you take per meal per day influences your sugar levels. And that is why you've been advised to eat less carb, more fiber. Okay? Feel free to ask me any question. B, let's go to B. When you eat too many carbs or have insulin function problem, this process fails and blood glucose level can rise. That's what I just explained. So when you eat too much carbs, when you're eating too much carbs and then your insulin is not functioning properly, then there's a problem. That is when you develop diabetes, because now all the excess sugar is being dumped into your bloodstream and there's an elevation of sugar level in your bloodstream. That is when it becomes diabetes. So when you eat too many carbs or have insulin function problem, this process fails because your body is not producing enough insulin that your body requires to regulate the sugar levels in your bloodstreams. What happens? It dumping all the excess sugar in your bloodstreams, and there's a rise in your blood sugar levels. That is what is called hyperglycemia. Okay. Now let's go to C. Diabetes Association recommend that people with diabetes manage their carbs intake by counting carbs. I've said this several times. You have to learn how to count your carbs and being aware of how many they need per each meal or per day. Okay, you must learn how to count carbs and know how many carbs you need per each meal or per day. By understanding how to count carbs, by knowing amount of carbs you need per meal or per day, will help you in managing your sugar level. Okay, so it is important that to manage your diabetes, okay, you have to manage your carb intake by counting carbs. It is very important. You have to learn how to count your carbs. Now, let's do something here. If this is your first time on my page, do not forget to subscribe to my page. Give me a thumbs up, comment, and share this page. Okay, I'd like to read from you guys. If this is your first time, if you're not subscribed to my page, do kindly subscribe to my page. Give me a thumbs up if you like what I'm doing. If you like this video, give me a thumbs up. Do not forget to comment and share this page to your friends. All right. So once again, you are welcome to Living and Managing Diabetes. So let's go back to uh, D1. D1, you can still eat some carbs okay, when monitoring your blood sugar. However, prioritizing whole grains over processed ones and refined carbs provide greater nutritional values. Even when you are counting carbs, even when you are monitoring your sugar levels, you still can eat carbs. But the question is that you have to know the amount of carbs you consume per each meal or per day, and then the kinds of carbs. Instead of going for carbohydrate food, go for whole grains, oatmeals over processed ones. As a diabetic, you have to deal with processed food. Processed foods are not good for diabetics, okay? Or refined carbs, okay? So always prioritize whole grains or oatmeals over processed food, okay? Over processed food. Now let's go to D2, okay? Why I say this is D1 is you have to read D1 to understand D2. You can still eat some carbs when monitoring your blood sugar levels. However, prioritizing whole grains over processed ones and refined carbs provide greater nutritional values, okay, while helping decrease your blood sugar levels. So you have to consider going on whole grain. Anything oatmeals is far better than processed ones and refined carbs. Stay away from refined carbs, all right? So instead of refined carbs, go for complex carbs. Complex carbs are very hard to break down and they cannot impact your sugar level very fast. Refined carbs, yes, can have a debilitating effect in your sugar level. They can spike up your sugar level very fast. So let's go to E. It is important. Listen, this E is very important. E is very important. It is important to know that low carb diet, and no carb diet are not the same. You have to understand that low carb diets and no carb diet are not the same. Have that in your mind. Okay. So, what are my final thoughts? Your body breaks down the carbs you eat. Your body breaks down the carbs you eat into glucose, which then raises your blood sugar levels. As such, reducing your carb intake can aid blood sugar regulation. So, everything depends on reducing your carb intake. Okay, your body breaks down the carbs you eat into glucose, which then raises your blood sugar levels. As such, reducing your carb intake can lead or can aid blood sugar regulations. That's why I said, okay, you know, some people might be complaining, I'm on medication, I'm drinking my medication according to my doctor's impression, but why is it that all the time my sugar level is high? Why am I getting feeling sick all the time? Because you are not reducing your carb intake. And I've said this several times. Okay, you can drink as many diabetes medication you can take. If you are not reducing your carb intake, if you are still taking your medication and you are eating too much of carbs, it's like going on a round cycle. You still be having too much high blood sugar levels because you are not reducing your carb intake. That is why taking medication does not mean you have to go and keep eating a lot of carbs. Taking medication, will help you to waking up your metal cells to produce enough insulin that your body needs to regulate the sugar content. But once you are still eating more than enough carb, your blood sugar level is going to be high. So that's why I said your body breaks down those carbs to eat into glucose, which can then raises your blood sugar levels. As such, reducing your carb intake can aid blood sugar regulation. So if you are taking medications, try to reduce your carb intake. It is very important. Try as much as you can to reduce your carb intake. Okay? Do we have any question? Okay. Now I'm going to go to number three. Number three, easy ways to lower your blood sugar level naturally. Remember, I said I'm going to give you guys up to six, but I'm going to try to see if I can squeeze them out. Number three of how to reduce your sugar level naturally is eating more fiber, less carb, more fiber. Okay, less carb, more fiber. So eating more fiber is very important. Fiber slows carb digestion and sugar absorption, thereby promoting a more gradual rise in blood sugar levels. That is why you see they ask you to eat more fiber content food than carbs. And if you're going to go on carbs, do not go on refined carbs, go for complex carbs. Complex carbs are very hard to break down. Your body cannot break down complex carbs very easily. Refined carbs, yes, your body can break them down. As soon as you're eating them, it's breaking down and then rising up your blood, spiking up your blood sugar level very fast, imminently. So that is why it's the same thing on fiber. Your body cannot break down fiber very easily. Fiber takes a long time for your body to break down. And because it takes a long time to break down, it doesn't spike or have an effect in your blood sugar level. And that is why you are being advised eat more fiber than carbs and less carb. Because fiber, your body cannot break down fiber food very easily. It takes a long time to break them down, and it doesn't have an immediate effect in your blood sugar level. All right. Why refined carbs or carbohydrate foods, your body can break them down very easily. As you are eating them right away, it is breaking them down and then it's spiking up your sugar level. So you have to eat more fiber and less carb. So fiber slows carb digestions and sugar absorptions, thereby promoting a more gradual rise in your blood sugar levels. This is very easy to understand. Okay. So we have two types of fiber. We have the insoluble fiber and we have the soluble fiber. Okay. There are two types of fiber. We have the insoluble fiber and then we have the soluble fiber. Okay. While both are important, soluble fiber has explicitly been shown to improve blood sugar management. Why insoluble fiber hasn't been shown to have this effect. So instead of you got to stay away from insoluble fiber and more or less go for soluble fiber because soluble fiber has been shown to improve your blood sugar management than insoluble fiber. So I advise you that when you are looking for fiber food, go for fiber food that are soluble fiber. Stay away from food that are insoluble fibers because they will have an effect in your blood sugar level. Why soluble fibers, improve your blood sugar management than the insoluble fibers. Remember, on the carbohydrate, we have the refined carbohydrate, we have the complex carbohydrate. As a diabetic, always go for the complex carbohydrate. Stay away from refined carbohydrate because refined carbohydrate is going to have an effect in your blood sugar level immediately. Why complex carbohydrate does not have an effect in your sugar level. Then when it comes to fiber, we have the soluble fiber and we have the insoluble fiber. Always go for the soluble fiber because they have shown to improve your blood sugar management because they do not spike up your sugar levels. Why insoluble fiber is the reverse. It's going to have an immediate effect in your sugar level. Okay, so that is why as a diabetic, you have to understand when it comes to dieting, it's very complicated. It's very difficult because that's where the confusion is. But once you understand it, you'll be able to live and manage your diabetes effectively. Okay. Now, a higher fiber diet can improve your blood ability to regulate blood sugar and minimize blood sugar lows. These could help you better manage your type 1 diabetes. So, what is it saying in all is that eat more of fiber food than uh, carbs. So let your diet contains a lot of fiber. Eat more of fiber food. All right. A high fiber diet can improve your body's ability to regulate your sugar levels and minimize blood sugar lows. This could help you to manage your type 1 diabetes if you're a type 1 diabetes or juvenile diabetes. Okay. So do you have any question? Do you have any question? Now let's look at food that are high in fiber. Okay. Let's look at foods that are high in fiber. Foods that are high in fiber include vegetables, fruits, legumes, whole grains. The recommended daily intake of fiber is about 25 grams for women, and 35 grams for men. So if you're a woman, if you're a lady, your daily fiber intake is supposed to be 25 grams of fiber each day, and for a man, it's 35 grams of fiber each day. Okay, that's about 14 grams. That's about 14 grams for every 1,000 calories. Okay, let's go back again. Food that are high in fiber include vegetables, fruit, legumes, whole grains. Now, for women, your daily intake of fiber is 25 grams, while for men is 35 grams, which is about 14 grams for every 1,000 calories. So does that make sense? Which is about 14 grams for every 1,000 calories. Yeah. Now, what is my final thought on fiber? Eating plenty of fiber can aid blood sugar management. Soluble dietary fiber appears to be more effective than insoluble fiber for this purpose. So, if you're a diabetic, look for soluble fiber and stay away from insoluble fiber. Food that are rich in soluble fiber, okay, will help you in managing your diabetes, your sugar levels. But stay away from foods that are insoluble because it's going to have the reverse effect. Okay. So let's go to number 4. Drink water and stay hydrated. Okay. Number 4 of the natural way to lower your blood sugar is drinking a lot of water and stay hydrated. Drinking enough water can help you keep your blood sugar level within healthy range. Okay. Drinking enough water could help you keep your blood sugar level within healthy range. In addition to preventing dehydration, it helps your kidney flush out excess sugar through urine. Because once you are drinking a lot of water, the water is going to help to flush out excess sugar through your kidney, flush them out. That is why you have to drink a lot of water and then be hydrated. Instead of dehydration, make sure you are hydrated. That is why you have to keep drinking a lot of water because it's going to help also to flush out through your kidney process because your urination starts from your kidney. All the filtration starts from your kidney until you pass your urine. So it's going to help to flush out excess urine, excess sugar through urine. Okay, so so those that drinks a lot of water stand a chance of a lower risk of having high blood sugar all the time. So make sure you drink a lot of water. Make sure you stay hydrated. Avoid hydration. Okay. So drinking water regularly may hydrate the blood, lower blood sugar levels, and reduce diabetes risk. So try as much as you can to drink a lot of water. Keep in mind that water and other zero-calorie drink are best. Okay. Avoid sugar sweetened options as this can rise blood sugar levels. So stay away from puffs. Anything that contains a lot of sugar, puffs, stay away from it. Once you're diabetic, you have to give up all those things that contains a lot of sugar in them, and make sure you drink a lot of water, and then stay hydrated. Okay, so that is in the number 4. Number 5 is that you have to learn how to implement portion control. I've discussed about portion control. Okay, I've discussed about portion control. I've discussed about portion control. So number 5 is implement portion control. So instead of you eating too much of, before you are not when you are not a diabetes, you eat one big portion of food at one go. But once you're a diabetic now, you have to implement portion control. Okay, you have to eat in a smaller quantity, no more in a larger quantity. You have to divide your food in portions. Remember, you have to learn how to count your carbs. Okay, portion control can help you regulate your calorie intake and maintain a moderate weight. Okay, so and monitoring your serving size also help prevent blood sugar spike. Okay. So why you have to implement portion control is that when you are implementing portion control, you are controlling the size of food you eat. You're no more eating one large quantity of food. And once you're implementing portion control, you are taking into consideration counting carbs. Remember, you have to know how many carbs per meal or per day. Because now that we are taking portion control into consideration, the size of your carbs intake will reduce, your fiber intake will increase. So now you're going to eat in a smaller portion. Okay. Reduce your carb intake, count your carbs to know how many carbs in that meal, and then at least make sure you eat in smaller sizes. So in a within 24-hour period, maybe you eat every 4 to 5 hours. Every 4 to 5 hours you eat. So instead of eating one large food, because the bigger the quantity, the more carbs in it, and that's going to have an effect in your sugar levels. Okay. So let's talk about here are some helpful tips for managing portion sizes. Okay. One, measure and weigh your portion. Okay. One, measure and weigh your portion. Okay. Two, use smaller plates. Okay. Two, use smaller plate. Number three, avoid, I've said it several times, avoid patronizing fast food joints. Avoid all you can eat restaurants. Okay. Avoid all you can eat restaurants. Okay. Four, read food labels and check the serving sizes. Okay. Read food label uh, and check its serving sizes. Okay. And five, you have to eat slowly. Eat slowly. All right. So let's go over each once more. When I say implement portion control, is you have instead of eating one large quantity of food at a go, now you have to reduce it in a smaller portion. Because the more food, the larger the food, the more carbs in it. And once you are now counting your carbs, you have to eat in a smaller portion. So within 24-hour period, you have to eat every 4 hours or every five hours. Okay. And then because within those, as you divide those meals in smaller portions, your carbs is going to reduce and then your fiber is going to increase. So that is why you have to implement portion control. And portion control can help regulate your calorie intake and maintain a moderate weight. Okay. Now, monitoring your sizes also helps. Monitoring your sizes also helps prevent blood sugar spikes. Okay. Now, what are the ways? Some of the tips for managing your portion sizes. I said number one is measure and weigh your portion. Okay. Number two, use a smaller plate instead of a bigger plate. And number three, avoid all you can eat restaurants. Avoid patronizing fast food joints. Okay. And number five, read food labels and check the serving sizes. And number five, eat slowly. So this is how to implement your portion control, and that's going to help you to reduce your sugar level naturally. Okay. This is going to help you to reduce your your blood sugar naturally. Do we have any question? Today has been silent. All my fans today has been silent. Where did you go? Everybody's been silent. Okay. So let me round up because my time is up. So let's round up for today's program. Today I was discussing about easy ways to lower your blood sugar naturally, and then you can lower your blood sugar naturally without depending on medications, or you can be on medication, but at the same time, there are other ways you are using to implement to manage your sugar level to be at a lower stage. Now, give you guys the tips what you can do to lower your blood sugar naturally. I gave you guys about five instead of six. Okay, I gave you guys about five instead of six. And I said one is exercise. You have to exercise regularly, manage your carb intake. Okay. The third one is you have to eat more fiber. The fourth one is you have to drink a lot of water and stay hydrated. And then the fifth one is implement portion control. Okay. So this is five ways you can manage to lower your blood sugar level naturally. But you have to be disciplined in order for this to be effective. If you are not disciplined and if you are not taking your diabetes treatment very seriously, then you stand a chance of having other complications. So, in order to avoid those complications, is to take your treatment very seriously. Okay, if you decide not to be on medication, but to handle it your own way naturally without being on medication, and you want to use exercising and then dieting, then it is very important you have a very strict discipline exercise plan for yourself. And at the same time, you have to balance your diet, make sure you're eating healthy food. Eating healthy food, balance it properly, more fiber, less carbs, drinking a lot of water, and stay hydrated. These are the ways you can lower your blood sugar naturally without being on medication. And let me repeat once again, it is not mandatory that you have to be on medication to control your blood sugar naturally. There are thousands of people that are diabetics, they are not on medication, but they were able to manage their blood sugar regularly, maintain it normally without being on medications. It's doable. The question is you have to be physically and mentally fit and disciplined to take treatment of your diabetes very seriously. There is no cheating about it. If you cheat, you are cheating your life because at the end of the day, you are going to face the consequences or the complication that comes with ignoring treatment of your diabetes. So I always advise all patients, all my friends, those that are listening, to make sure you take serious treatment of your diabetes situation. Very important. If you're a caregiver, make sure you are taking care of him or her very seriously, and then work hand in hand with your family doctor. You must at all time communicate with your family doctor and listen to your family doctor in the plan they map out for you in treating your diabetes. It's very important you listen to your doctor and follow the guidance of your doctor in treating your diabetes. It is very, very important. Okay. And if you are confused, go back to your family doctor to help you answer some questions that you are facing at that particular time. Do not forget to listen to your doctor at all times in managing your diabetes situation. So, as I said, it is not a must. You must be on medication to treat your diabetes. There are a lot of people that are not on medication, but they are able to manage their diabetes effectively and normal at all times. But it takes a lot of discipline, self-awareness, serious situation. You understand the consequences of ignoring treating your diabetes, what the complication is going to be about. So once you have all those things mentally fit, you should be able to know that there are other ways to manage effectively in treating your diabetes without being on medication. And those are the natural ways that I just listed. I gave you guys five. There are more, but I'll just give you guys five for today because I don't want to do do the video for 2 hours because I have to. 1 hour is okay, at least to save your data watching it. So once again, if you guys have any question, do not forget to send your question. Okay, send me your question. Leave me a comment. If you like this video, please give me a thumbs up. If you like this video, give me a thumbs up, and then subscribe to my channel if you're not subscribed to my channel, and invite your friends to join this program. Once again, I'm going to thank you guys for today being September the 23rd, 2023. Okay, thank you for welcoming me into your home and sharing your time with me. So I'm going to see you guys tomorrow, Sunday, September the 24th, for another day program. All right, so join me tomorrow for another day program. See you guys next time. Goodbye.